Welcome back. Now, 5 counties in Kenya continue to bear the highest burden of HIV infections and teenage pregnancies. Kenya's maternal mortality rate remains alarmingly high, with a significant proportion of these deaths involving teenage mothers across the country. Experts cite parental neglect, poverty, cultural practices, and inadequate funding as key challenges. Rozongoi has more details.
In Kenya, the battle against teenage pregnancy rages on. While recent data shows modest improvements, 5 counties continue to shoulder a disproportionate burden of this national crisis. A report by Her Health Project Kenya reveals a troubling pattern. Statistics paint an equal picture between girls aged 15 and 19 being pregnant and accounting for new HIV infections. While many adolescents have heard about HIV and AIDS, accurate knowledge remains low. At least 51.1% of adolescents in Homa Bay have knowledge of HIV, followed by West Pokot at 38.4%, Tana River at 35.3%, 24.0% in Samburu, and 15.1% of adolescents in Garissa County have limited knowledge about HIV. In the survey, Samburu and West Pokot counties contribute to the highest numbers of teenage pregnancy, ranging from 8.7% and 6.1%, followed by Tana River at 5.2%, Garissa at 4.2%, and Homa Bay at 2.9%. This growing concern has led the Ministry of Health in partnership with the Reproductive Health Network Kenya to implement a project dubbed Her Health, which will help strengthen critical gaps in sexual reproductive health and maternal health in the 5 targeted counties.
We have chosen these counties because of their high maternal mortality, high HIV rates in some of the counties, high teenage pregnancy, high rates of sexual-based violence, and female genital mutilation. Our plan is to make sure that the services of reproductive health reaches across the mothers in those counties.
Some of the notable systematic barriers to sexual, reproductive, and maternal health include limited county-level influence in policy formulation, inadequate service delivery capacity at facility level for the growing adolescent population, and lack of sufficient health financing.
It's like Samburu, 50%. Each 2 girls, 1 is pregnant. So which means if more than 50% out of the MMR or maternal mortality is coming from teens, definitely we are losing 50% of that 50%.
Challenges that we face is the distances from one facility to another. We have part of our communities become migratory, especially during this drought. So again, you are not able to keep a good eye on the situation of the mothers.
Experts attribute this to persistent cultural barriers, limited access to accurate sexual and reproductive health information, and inadequate maternal health services tailored to adolescent girls and young women aged 15 to 19.
FGM is really a broad issue across the county, and an aspect of early marriages. This tends to increase the number of teenage pregnancies around. We only have 2 facilities across the counties that offer cesarean services.
The report is calling on the government and partners to take urgent steps to equip teenagers with the knowledge and skills to keep themselves safe from HIV and unintended pregnancies. Rozongoi, NTV.